Tip number 9, treat the exam like a regular clinic. Now this is quite easy to say but quite difficult to do, but actually if you consider that you're just doing a clinic with the benefit of a short break halfway without having to write up any notes on the computer as a bonus, then it'll help you be more natural. Don't do any acting. The only person doing any role play should be the simulated patient. They're being paid to do it, they're a professional in it. You should be doing the same things that you would do if you had a similar case in real life. Because sometimes what some candidates do is that they act in an odd way for the exam. For example, they'll make up a false option that would never offer in real life, or they'll pretend to write a prescription rather than using the actual sample prescription on the table. And sometimes this can be really awkward or unnatural and even embarrassing. For example, sometimes someone will, pretend to give a leaflet and then the simulated patient will say, well, there's nothing there. And try to imagine the examiner's not there. Don't look at them, don't talk to them, don't engage them. They're there to mark the case, not to influence the outcome. You focus and make good eye contact and give attention to the patient in front of you, okay? And ask yourself, would I do this in real life? Will it help me help this patient? If it would, do it in the exam, it'd be fine. Don't do something to tick an imaginary box. Tip number 10, focus only on the case at hand. In an exam with 13 cases, there might be 1 or 2 cases that either don't go as well as you'd like, or that include a less common disease or a high challenge presentation, or something that actually we don't expect a GP to know about. That could be part of the test. Perhaps they're seeing how do you deal with medical uncertainty, which is an important skill in general practice. Remember that a bad performance in any one case can be compensated by doing really well in others. So just do your best to listen carefully to the patient, try to be safe, communicate clearly. If you have something that you're not sure of, show that you're going to be safe and find out, explain what you can, and highlight that you're going to get more information and come back to them. That may be part of the case. At the end of any case, if it didn't go as well as you want, take a deep breath, clear your mind, go into the next case with a positive attitude. Because sometimes if you have one case that doesn't go as well as you want, if you can't let it go and clear your head and your mind, it can then have a bigger impact because it can sort of affect your thinking for the next 3 or 4 cases and really drag you down. Whereas if you had one bad case and you let it go by doing well in the others, it'd be fine. So to summarize, the CSA is a challenging, high-stakes exam. To pass, you need to demonstrate you have the skills and the knowledge to practice safely without supervision. So that includes taking a structured history that's safe, a focused examination, being up to date with your management, being able to explain things well, that you can communicate clearly and effectively, engage and involve the patient. Finally, you need to be able to manage your time well to get through everything in 10 minutes. So I hope these tips have been helpful in your preparation, and we'll be posting some more videos looking at some specifics, including some clips and tips of specific cases that you might face in CSA. If you've got any particular queries, feel free to contact me and you can get more information. I'll post some links in the links underneath this video. But I just want to wish you every success with your preparation and with your CSA exam. Thank you so much.